Namaste everyone. I'm Dr. Vasudha Sharma, Director of Medical Services and co-founder of Vivekananda Health Global, which is the chain of integrative medicine centers where we use Ayurveda, yoga, and naturopathy for delivering the best treatment outcome to individuals. So we work on preventive health management, healing solutions for different lifestyle disorders, and also rehabilitation. Well, it's my pleasure to be presenting before you about how Ayurveda and yoga can actually help deal spinal health problems. So we are going to discuss about how these two traditional systems of healing are very useful for spinal health, be it prevention or be it healing. Both are very important, and they complement each other. Well, before we get into the understanding of the same, it's very important for all of you to know a little more about how our spine is, what exactly happens there, and why do we need to take a lot of care. So we are all vertebrates, those of us who have vertebral column. So this is the defining feature of all of us, and of course many more vertebrates. But when we look at our spine, we have three main curvatures denoted with the spine, which is the cervical curvature, the thoracic, and the lumbar. So, similarly, these curvatures are basically made up of the different vertebral bodies or the vertebrae, which are the bones of our spine or the back, right from the neck to the lower back. So, they are divided as cervical vertebrae, which are 7 in number, thoracic vertebrae, which are 12 in number, lumbar, which are 5 in number, sacral also, which are 5 in number, and coccyx, which is 1. Though it is just 1, it can trouble us a lot when there are some issues related to the tailbone or the coccyx. Why are we actually giving a lot of importance to spine? And all of us are kind of scared, isn't it, if something happens, if we fall. Oh, I've hurt my spine, I've hurt my back. This is because there are a lot of nerves which pass through the spinal cord, the brain, the spinal cord pass through this vertebral column, and this is what is supporting all of that controlling mechanism in the body. Therefore, it is very important that we maintain the support, the stability owing to the spinal health, because it is important to maintain this integrity. Like we say, that you have to maintain your integrity at work. That means you'll have to work properly, and there is a certain system in place accordingly. Likewise in the body also. So when we have to maintain this neurological integrity, we have to protect the spinal cord and its nerve roots. So you can see a beautifully braided plated structure, as though there is a lady with a long braided hair. So this is how the spinal cord also looks. And you can see a lot of the nerves which are moving away from two different parts of the body from the spinal cord. And therefore a lot of the sensations which we feel, which is like heat, cold, any form of temperature, therefore tingling sensation, burning sensation, numbness, all of them are due to the actions of the nerves. So when you have a problem, you have a problem where there is a compression of a particular nerve, then definitely you have shock kind of a sensation, because many patients also do tell us at clinics that I feel that there is a shock kind of a sensation which passes through my hands, which passes through my legs. So it's important to understand that such a scenario you definitely need to meet a doctor. And what all do you need to work on, and why do you need to work on? The supporting structures of the spine are the muscles, the tendons, the ligaments. So there are a lot of muscles in front, muscles in the back, the side of your chest and abdomen. These are all the muscles which are actually holding the spinal column, and within that the spinal cord. So maintaining them with regular exercises, yoga play an extremely crucial role in maintaining spinal health. And one other aspect I want to bring to all of you to your notice is there is a small structure which you can see here. There is a greenish substance within and a bluish ring around. So you may be wondering many times, how does this vertebra look from inside? What is there inside? And how is it so strong? How does it protect us? So this is one of the factors due to which the spine also gets its strength. Especially, it's able to transmit stress and weight from one vertebra to another, because the vertebra is a column, like you can see here, one below the other, holding on like this, one above the other also. So this jelly like substance within is called the nucleus pulposus, and it is also made up of fat. And you have the surrounding ring like structure, which is actually something which supports this jelly substance. You hear about synovial fluid, which is drying up if you have a knee joint pain. Likewise, in the vertebra, if there is a loss of this, you see that the intervertebral disc space starts reducing. And this is, of course, one of the reasons for pain or back issues. Now, when we say, what are the problems we acquaint when it comes to the spine? First of all is a pain. Now you are playing maybe football, you want to lift a weight, and then, oh, my back is into spasm. I have a sudden jerk, a sudden a kind of click sound sometimes. Oh, or maybe that your muscle is tightened or under spasm. So all these are certain factors why you get into pain. And this particular problem which happens in your back is your lumbar pain, which is highly prevalent. Similarly, is the cervical pain or pain in your neck area. You may all be sitting, for long hours. There is desk job involved, and if there is lack of exercise or very minimum exercise, not sufficient to keep your bone health, joint health, muscle health, then you will definitely get prone to pains. But the next part of it is the thoracic area, where the pain is little less prevalent. Maybe injuries or trauma can cause problems in the thoracic area. Then comes the sacral and the coccygeal areas. So the sacrum has 5 vertebrae as mentioned, but it is fused. And there are always chances that at times, especially when you're sitting, this is the place, the sacrum and the coccyx are in the later portion of your spine, so they always are compressed. So maybe sometimes if your weight is more, or even otherwise if there's lack of exercise and the muscles are lax, there's not much of support, then you can definitely experience these pains. And coccyx always tells you, I'm the only one, but I can trouble you a lot. That's usually how the coccygeal pain also manifests. The tailbone pain, people are unable to sit. You must have maybe heard from friends, colleagues, who say that, oh, I'm not able to sit on my seat nowadays, and I need to stand. I see patients in the clinic with coccygeal pain. When they come, they stand and literally talk to me because they're unable to sit for more than 10-15 minutes. But there are answers to all of these. So first of all, as we answer how you can manage your pain, it's also important for you to know the triggers of pain, because this is also a part of the treatment, whether it's prevention or management. There are factors denoting to the bone muscles like osteoporosis or muscle sprain, which are definitely some of the reasons for the pain, or a fall, trauma, fractures, etc. But let's concentrate a little here on lifestyle factors. The foremost is stress. Now, why do you think stress is one of the reasons why pain can occur or pain can increase? That's because when you are stressed, there are certain hormones like cortisol which are released, which can increase inflammation in your body. Secondly, stress also increases the pain sensations. It aggravates the way the receptors work. Those are the nerve endings which work on pain. This can also enhance, that kind of a pain perception which you get. Therefore, it is very important for you to keep your stress under control. We can't run away from stress. I'm not saying so, but we need to adapt methodologies and mechanisms to counter stress. Therefore, reducing the load on the body will be very, very essential for good health. Next is sleep. Some of you might feel, oh, I'm giving myself 8 hours sleep. But what time are you sleeping? You're sleeping at 2 a.m., waking up at 10 a.m. Is that what you call good sleep because you are sleeping for 8 hours? Definitely not. Because what your body needs is maintaining that nocturnal rhythm and diurnal rhythm, which is essential for good health, which is also called as circadian rhythm. So essentially, sleeping say 10 o'clock, 11 o'clock maximum, waking up at around 7, 6 will be very, very ideal for good health. And especially with respect to maintaining spinal health and avoiding triggers, you should keep a watch on your hydration. You are in air conditioned environments with regulated temperatures, may not be sweating more. So what happens in that case? You are not taking enough of water. So keep in mind and understand that your hydration is equally important to maintain spinal health, because once the dehydration sets in, muscles also become lax, and you don't feel energetic. Your pains can increase. Just imagine how you feel when you're outside in a very hot place with not enough water, or you've had an episode of loose motions, and then how does your body feel? Okay, that's because of dehydration. Similarly, when you're not taking adequate water, you may not feel this problem to be so intense like I just explained, but some form of it is definitely visible. The other important factor is the activity. What do you do? Floor exercises, yoga, walking, you go to the gym. All these are important, but what's very important is practicing aerobic exercise. And that is going to play a very crucial role. And yoga is one of the foremost aerobic exercises. Whether I would not call it an exercise, but it's what I'm trying to explain is why we recommend yoga and how is it very useful, because it gives oxygenation to the body. And when it comes to diet, sure triggers are fried food, oily food, junk, processed food, and then you have stale food sometimes, which is kept in the refrigerated but not called stale. But these definitely have influences on your health. Whether it is cook the food, keep it in the refrigerator, heat it every day, eat it, or you make a dosa idli batter, keep it in the fridge, and use it for 3 4 days. All of them are quite similar. So please refrain from using a lot of refrigeration, reheating, especially also reheating in the microwave. Um, Please keep a watch on many of such aspects. So how do we exactly look at treatment? So conventional medicine, modern medicine, also called as allopathy, offers different levels of treatment, say, which can start at rest if you've just had a pain maybe from 2 days, or even if you have had it mild to moderate. But next level is with combination of analgesics, muscle relaxants, physical therapy or physiotherapy, and if nothing works, then you can also go in for a surgery. But yes, there are certain conditions like herniated disc, untreatable sciatica, which go into surgical intervention. But after evaluating all the basics, such as an MRI, X-ray, and all the blood parameters, of course. Likewise, since there is limitation in the conventional approach, it is very important for all of you to understand how Ayurveda and yoga can help you. Look back into your traditions, look back into what probably you followed as children, and how you can alter your lifestyle, because they are very much evidence-based sciences, and we understand the depth of the science very well. So the perspective to problems of spine are brought under the broad category of vata disorders. Vata refers to the element in the body which can control your nervous system, which can regulate lot of movement in the body. So there are three elements. One is vata, pitta, and kapha. So what are they? No, you know about a tripod. So it has three legs. Vata is one of the leg. The other two are pitta and kapha. Even if one leg is broken, the tripod cannot stand. It's going to fall. Likewise, are these three in the human body. Whether it is health, you need to have the balance in the doshas. Whether it is disease, you need to have the balance in the doshas to get out of a disease. So these problems owing to the spine especially are called Asti Majjagata Vataroga. The Vata disorder which is targeting the bone and the bone marrow, that is Asti and Majja. So we also have reference to lumbar spondylitis, which is called as Kati Graha. Kati meaning lower back, Graha meaning stiffness and spasm. So sciatica also has a reference in Ayurveda, and it is elaborately explained under Gridrasi. Manyagata Vata is one of the other problem, which is mostly correlated to the cervical spondylitis. So this is just an overview for all of you, but you should, and with the perspective that you should know that the science is well advanced, and all these have been told 5,000, 6,000 years ago and not recently. So likewise in yoga also, though they don't have nomenclatures like this, you can understand all these problems such as pain or lifestyle problems, more so such as even diabetes, under the group of adhija vyadi, which means they are stress borne disorders. So how do we handle them when it comes to the problems in Ayurveda and yoga? So when somebody comes to us with an acute pain, okay, I've got, say, shooting pain in the last 2 days, now how can you help? So this is one. Next, they would have had probably history of pain over 1 year, 5 years. They've been managing the pain through different modalities, and then somebody has advised them a surgery, so they come. So there are many situations like this. So we first intervene with Ayurveda to bring down the inflammation, to see that the body is soothed, the muscles are relaxed, the nerves are relaxed, to start initiating the reduction in pain. So some of the treatments used therefore are Kati Basti, which is oil pooling therapy on the back, Griva Basti, which is similar, it's an oil pooling therapy on the neck. So you can see this in these pictures. And there are also additional therapies such as Elekiri or Patrapinda Sveda, where we give fomentation to a affected area, like in this image, where this bundle is made up of medicated leaves and powder. It is dipped in warm oil and then fomented on the affected area. And when it comes to management after administration of these treatments, yoga is very, very essential, because it can work in not only reducing that remnant pain, but also in preventing the problem. So it's very important that we use this integrative approach. And at Vivekananda Health, we predominantly do tap into the best of the systems of medicine, so that we are able to aid people's recovery. So therefore, the integrative therapy is also kind of superimposed many times with treatments of panchakarma. So panchakarma are detox therapies in Ayurveda, and they are Asvamana, Virechana, Basti, Nasya, and Raktamokshana. Many of you, I'm sure, would have heard these names. So when we talk about eliminative therapies, like all the five, we don't have to administer all the five. But when we treat spinal problems and chronic problems, Like like I just mentioned, you have a history of 5 years of pain and it's not gone away. It keeps coming every 6 months, and right now your pain is so bad that you're not able to stand, or you have a lot of tingling. Say if this is the kind of case, then it's important that we give them these external therapies, but also give them an internal cleansing to restore the balance of the doshas, which is very, very essential for long term relief. Otherwise, you might find recurrence here also. So, the Panchkarma treatments widely used are Virechana and Basti, which mean purgation, that is loose motion therapy, and Basti, which is like a rectal route of administering medication, similar to enema, but we use medicines because when we administer medicine through the rectal route, it is fast absorbing and highly effective. Likewise, Ayurveda, yoga, acupuncture is another great modality which we use very commonly in cases for pain management at our centers. So it works on a very special theory of gate control where it can control the neuronal receptors, in the transmission of pain. So overall, when you look at this combination of usage of oil, you will have a question, I'm sure, how does this work? So there is a transcutaneous absorption of the medicine which is in the oil. Oil is a media, to also reach this medicine. Overall, there is reduction of pain, disability, then and a definite improvement in quality of life. But the crucial element you have to note is the psychological well-being. We said that stress can aggravate pain, and we are aware of it, but you should be very clearly aware that when there are painful conditions, your mind also has to be addressed. The mind body balance has to be better, otherwise your recovery is not going to be uh, probably as good as it can be. So who doesn't want the recovery to be good, isn't it? Therefore, Ayurveda, yoga are holistic systems which work on the mind body complex. Talking about yoga, there is this concept of yoga therapy, which is very different from the yoga, probably many of you know. It's not like going to a place where people are offered kickboxing one day, yoga another day, and then you have floor exercises, and then you have lot more of dynamic practices. So this kind of a combination or a khichdi may not help you when you deal with health problems. So please keep that in mind. And it can also be the reason, a trigger for some problems in many individuals. So if you get a certificate saying you're fit, please go and venture out. Otherwise, you definitely have to look for some other options, and yoga therapy is one. So it's a beautiful combination of asanas, pranayama, relaxation, meditation, loosening, and breathing practices. And this concept is based on the Panchakosha concept, or the 5 layer concept, which is mentioned in the yoga text in the Upanishads. And therefore, it's a very effective model for treating health problems. And this has to be delivered by experienced people like the yoga teachers. Every yoga teacher doesn't have the expertise. Please also understand. They should have done their bachelor's or master's in the management of these health problems, which is called MSc in yoga therapy or a BSc in yoga, or medical doctors who have completed their naturopathic medicine, or other medical doctors who have done different other programs in yoga are the best people you should reach out to. So since we're talking about yoga, I'll also give you this details about a very simple study which says how the mind body complex has played a crucial role in recovery. So this particular study has been done where the intervention has been done for 10 days. One group of yoga has done a special technique called MSRT, which is called Mind Sound Resonance Technique. It is designed by the founder of Svyasa University, Dr. Nagendra. And with this, they've also undergone 30-minute physiotherapy. And in the control group, they have done supine rest, which is non-guided, and then they have also done the physiotherapy. So keeping this in mind, now see how interesting the results are. So this dark blue is denoting pre-yoga and the light blue is denoting post, whereas the dark orange is denoting pre-control, which is with physiotherapy and just rest, and the lighter shade is denoting the post. So how much change do we see? There is a significant difference between pre and post yoga when it comes to reduction of pain and tenderness. Similarly, you see pre and post changes in neck disability, flexion, and then extension. You have right lateral flexion, which is left lateral flexion. So they measured all these parameters. And the last aspect, but not the least, the state trait anxiety has reduced. So they have used a questionnaire which is called a state trait anxiety questionnaire, and they found that pre-yoga versus post-yoga, there is a reduction. So all these factors are going to play a crucial role in management of pain conditions. I'm talking about spinal pain specifically. So overall, how has yoga therapy helped? Because anxiety has reduced, emotionally you're more stable. There is more of that happiness in you, which is very important. And mobility, flexibility, such other physical factors have also changed or improved. But uh, very important are your lifestyle, which includes diet. Ayurveda and yoga both talk a lot about this, and no management or prescription is complete without these. So, all of you are uh, people who have long desk hours or long job on the desk. So, it's very important for you to take care of your positions, whether it's your position of the mobile, the position of your laptop, or your desktop. All are very, very important. Otherwise, as you keep going on and on without much of knowledge into it, you can get vulnerable to problems. And the way you carry your laptop bag or the way you sleep are also very important when you look at your lifestyle modification. And when it comes to diet regulation, a lot of fruits, a lot of vegetables, always the recommendation. Try to avoid a lot of raw vegetables because they carry a lot of pesticides also nowadays. Try to saute them, parboil them, half boil, half, sabji, curry, anything is fine. And fruits are also a rich source of micronutrients. Draw the kind of support needed for the body through some of the dairy products as well, and maybe some sun bath when needed, especially for vitamin D because it plays a role in managing pain. So Ayurveda and yoga have also given certain items not to be taken. We say vata food like potatoes or underground stems, a lot of heavy pulses. These are contraindicated, and also cold items, refrigerated items, using cooling your body using fan, AC. These are some pointers mentioned when we treat people with health problems, spinal health problems like spondylitis or sciatica. So this is the gist of how we manage, whether it is prevention, very important. Don't allow the body to get dependent or get more and more into pain. But also note that if you have a problem, you can resort to these systems. So some of the testimonials from our patients can also clearly give you this input of how they can effectively be managed. Like a case of lumbar spondylitis, after 15 days of therapy, how it really changed the person's overall health scenario, from being chronic for 7 years until last maybe 3 weeks where he's off pain completely. So likewise, whether it's a neck pain, back pain, sciatica, spondylitis, it's very important for all of you to know that they are very much treatable. You don't have to just resort to surgeries. And yes, if it is a need of the hour, an Ayurveda physician also has an ability or discretion, which can be said, okay, maybe I cannot help you beyond this. So why don't you please go to your orthopedic physician? So this is the way we'll have to work together. And for what we want, the person who is suffering to get out of the pain. So that is what Ayurveda says: Swasthasya swasthya rakshanam aturasya roga nivaranam. Upkeep the health of a healthy individual and treat the disease of a deceased. So I wish you all good health, and with these few thoughts from my end, my experiences, I close this session. And for any further queries, we can always contact us on 9591 336 226. Visit our website for any video consultation, because you don't have to be from Bangalore to get in touch with us. We also have centers outside Bangalore in Trivandrum, Guwahati, New York, and Seoul. So we are otherwise reachable. Visit our website and do uh, view our social media pages on Instagram, Facebook, and LinkedIn. So I'm glad to have had this opportunity to share all this information with you all. Thank you. Take care. Wishing you all good health, and namaste.